So for the next, we'll talk about a test that is done for syphilis. This is the VDRL. So the full meaning of VDRL is what? Venereal Disease Research Laboratory Test. Okay. So it's just a screening tool. So I'm just trying to screen to see if somebody has syphilis. If they have syphilis, what stage of disease, So syphilis is a sexually transmitted infection. It's caused by what? Treponema pallidum. That's the bacteria causing it. So it's a non-treponemal test, meaning it doesn't dictate the bacteria directly, but it's trying to actually what? Check if there's any immune system mounted against syphilis. Of course, if you see immune system mounted against syphilis, it shows that there's syphilis there. Okay. So the test dictates antibodies, hemoglobin G, hemoglobin M, that react with what? A mixture of cardiolipin, lecithin, and cholesterol. So these antibodies are not really specific for syphilis, so false positive can occur. But one thing is, if you do a VDRL test and it's positive, you can now still go on to do other tests that are basically what? Specific to the disease condition you want. So a positive result is usually followed by a treponemal test. That's a definitive test. That's a test that is basically aimed at that. So when is it used? Just general screening. If somebody is having symptoms of syphilis, like painless sores, rashes, swollen lymph nodes, right, as part of what? Sexually transmitted infection screening for general people living with HIV. So if it is reactive, shows that there's a possible syphilis. It's non-reactive, there's no antibodies, there's no likely syphilis. Alright. False positives might also occur because many other things can cause rashes, you understand? So that was it for the VDRL.